So, all over the newspaper today are articles. And the last couple of days, the Yakima Herald Republic, they tell your stories. Talking about making room, big headline. Memorial opens new evening clinic to give patients
That's right.
more options. Memorial brings on new staff, including some from Astria Regional, et cetera, et cetera, et cetera. So, the new CEO is not in town yet that I know of, coming in from Arizona. But Russ is still with us. Russ, good morning. How are you? Russ Myers, have a microphone there and let's chat. Good to see you, sir.
Good to be here.
Well, how in your transitioning role here, how hands-on are you still, or are you still wired in, or what's your connection?
Yeah, so I'm very hands-on. I think, it would have been typical that it would have been less hands-on as this thing wound down, but it's a pretty active time right now. And
Boy,
so
isn't it?
I've been working with the team as we are making some pretty big changes to adjust for the healthcare needs of this community.
Well, first of all, was there anything that you saw that in your own medical crystal ball that saw this happening, that this was a possibility that Astria would actually shutter the doors?
We've been planning for this for about a year and a half.
Yeah, okay.
I think, it's a challenging time in healthcare right now, and what was happening down the street from us is not atypical throughout the country. And our data told us that it was going to be challenging for Astria to maintain Yakima in the long term. And so we had teams getting together weekly to begin to project what we thought might happen and how we would adjust for it.
One of the first things that I heard, and I think Lance can concur, emergency rooms. Holy smokes, they're already overrun on both sides. How are you going to shuttle them all through one kind of place? Since that's how a lot of people have their first entrance into the hospital? How does that shake out right now?
Well, almost a third of our emergency room visits can be handled in a primary care setting, an urgent care or one of our healthy nows. And so, our emergency room utilization is also a statement about how easy people think they can get in to see their doctor. And so if they can't get in a timely way, then they go to the emergency room, which
Right.
makes sense. Our emergency room is a great emergency room. It serves people well. It provides great customer service. Our physicians and staff are fantastic. So the experience is always really good. But you can only handle so much, and I think we have come close to that capacity. And so when we were aware of Astria's closure, it became very apparent to us that we had to look at other strategies in figuring out how to expand capacity in the emergency room. And so the Healthy Now, as you just saw in the paper, expanded. And then we've also made, I think, an average of some 70 slots available in our primary care clinics to be able to see people on a daily basis. So what we're trying to do is keep the emergency room for true emergencies for patients.
See people that we've heard with healthcare issues over the years that a lot of people find themselves there because they don't have the other options and those kind of things, and it is more general care that they need than an emergent situation. However, I was on the floor with a kidney stone in your waiting room not that long ago, and I truly appreciate the experience I had. Thank you. I was a hurting puppy.
That's a true emergency room.
That was,
Yeah,
oh baby,
thank you
that
very
was
much.
a true emergency. Okay,
The heart center that Astria had, is this something that the Virginia Mason Memorial will go after, or do you think that how will that work? We've got a lot of heart patients now, or I suppose they have to go to Spokane or Seattle, right?
Well, Astria had Certificate of Need, which is a regulatory requirement in the state for a couple services. One is open heart surgery. They've been doing that historically for decades. And the second thing was for what we call elective angioplasty. So that's the ability to go in with a catheter into your heart arteries and unplug them. We recently received a regulatory approval to do those procedures as well.
Oh, good. Okay.
In our organization or in our hospital. We don't have permission, however, to do open heart surgery. However, I would say that throughout the country, we're seeing trends where you typically see open heart surgery programs that have a lot of patients. And you typically see them in large cities like Seattle and Spokane. I think what we're going to do, however, is we're going to take a look at all of those items. We're going to do it. We're going to analyze and see,
Sure.
is it feasible to continue to do here, or is there something we can do differently as it relates to open heart surgery? And then as it relates to the cath labs, we are looking at cath lab capacity and how we can make adjustments for that, both in the short and long term.
Explains why I saw Becky Teagard in the hallway blowing up those balloons practicing. She's like, in case she's pressed into service, then she'd be ready to go. As we look ahead, and you guys make the adjustments that you do, and in transition to a new CEO and all of that, is it possible to see a time when, rather than turn that building into a new McMinimans and multiple restaurants and all of that stuff, that it actually gets pressed back into a medical service someday, somehow? Do you know anybody out there in the medical facility world that could come in?
I think Astria would know that better than me. I don't believe we have any interest in utilizing that facility for healthcare. I think we're going to do whatever we can on our campus and whatever we can do on our site to expand capacity so that we can treat the patients in Yakima. If something goes in those particular buildings that's healthcare related, it may be something that is complementary, I would say, or supportive of the care that we provide. But I know we have no interest in going into that building.
Absorbing staff, if you have to expand, you're going to probably need more bodies, and we got a pretty good system to, I don't want to say screen, I mean, they're already working in the industry, but to determine who's out there looking for work and how you can bring them on board?
We've already done it. Yeah.
Yeah.
I mean, we've had a lot of work already with staff, and we've hired a number of Astria staff, some really good staff. There's some great people who have been there a long time and who are highly skilled, and I don't think it's any of our best interest to let those highly skilled people leave town.
Yeah.
So we're going through the process. We're making sure they're the excellence that we need to have at Memorial. But as the newspaper article talked about this morning, we have really increased our ability to put them through orientation. And orientation, depending upon the nurse or whatever position we hire, often takes months. And so that's a process that we're working on speeding up.
Sure. Yeah, how it's done here, and what the state requirements are for us, and our level of care, and how we want to treat our patients, and all of that. I could certainly see that. What do you anything that hasn't been brought out by other forms of media that you want the public to know? Is there a message that the departing CEO who finds himself pressed into greater service than maybe you would normally see at this time? What do you want the community to know about them being in good hands for healthcare at this point?
Well, it's a time of change, and healthcare is on a fast track for that. And I think this particular change that occurred is reflective of what's going on in healthcare. I think it's an opportunity for the community and the Memorial to partner together, perhaps in new and innovative and exciting ways, to make sure that we take care of this community. We have the capacity at Memorial, in partnership with our partnership organizations, to be able to provide not just the same care, but I think we have the opportunity to provide incredibly better care. And as I think of our new CEO coming in, I think she is coming in a very exciting time. We're going to be in a growth mode, and that's a lot of fun.
Yeah.
As a leader in an organization, and I believe that for everything I've known about her, she has the skills to be able to lead us through that.
So again, the old silver lining might be the new and turbocharged by circumstance opportunity for Virginia Mason Memorial to do even more and better than build on the track record you've already had.
That's exactly it. I think there is a silver lining here. I know it's a challenge for now for many, but I think there's a good long-term silver lining.
Thanks for your time this morning, Russ. Appreciate that very much. Good information for Yakima to know.
Yep.
And because there's a lot of folks out there really concerned about healthcare and what happens next, and where can I go, and We always call you our friends at Virginia Mason Memorial. We mean it, and nice for you to share some time with us.